wondered why you go through, pain, stomach pains, and it's consistent? Some of you are thinking, oh, maybe because I didn't eat on time, maybe because I took pepper and the rest. In this video, I promise to share certain facts and things to avoid to ensure that you don't keep making that ulcer worsen and you stay healthy and ulcer free. Now, I'll be answering certain questions as I go because I think I have fallen in love with this question answer setting because it helps understanding as we flow. But if you have other questions which may not be answered in this video, feel free to drop in the comment box. Please also subscribe to this channel. In this channel I'll be sharing content about your health and health tips, and maybe some ideas, questions you have can be used to create videos that can help you stay healthier and stronger. So first I'll be asking, what is an ulcer? Ulcer is an open sore in the lining of your stomach. An open sore. Now, it's just like a wound. Take for instance, you have a wound on the surface of your skin. The good thing about wounds on the surface of the skin is that over time they dry. Since the environment, if it is left well dried and treated, not contaminated, there's no germs around, it heals quickly. But in the stomach, it's always because it's a place where digestion takes place. So every now and then stomach acids are being released to digest food. We keep eating every day, right? So this ulcer keeps getting worse and worse. Now, what causes ulcer today? Two leading factors I would explain. The first one is H. pylori, also known as Helicobacter pylori. It's a bacteria, and this bacteria is treatable. So when you go to the lab, they take your blood sample, and check, and they confirm the presence. Then they prescribe drugs, anti-H. pylori drugs that can help to treat it. And once you treat it, then the bacteria is off, because what this bacteria does is to feed on the walls of the stomach, and when it feeds on the walls, it removes the coats that prevents the stomach acids from harming the skin, that's the walls of the stomach, and then before ulcer takes place. And then another current cause is frequent use of painkillers. Now, I understand that a lot of people have to go through, they're hustling, trying to make ends meet, stress, and then they come back, they start complaining of backache and so on, and then immediately they go to maybe a chemist around and say, please mix drugs. Some people love doing that, especially where I come from, and then they say mix drugs, and nurse, please mix drugs for me, and you'll be like, wow. And then some of those ones, because I don't support that, then they mix all kinds of things, drugs like diclofenac, ibuprofen. All these drugs are classified as NSAIDs, steroidal anti-inflammatory drugs. So these drugs are being given to you. Yes, they have to manage pain, but these drugs also have a way of working. The mechanism of these drugs have a way of affecting the stomach or leading to acids and ulcers. To be true, those who frequently use, a lot of research has been done that most users of these drugs come down with ulcers, and the ulcers are usually painful and the rest. Then people struggle for so long. The next question is, what are the common ulcer symptoms? Common ulcer symptoms. First is that burning sensation. I hear people say like chest burn and the rest. Some it is down. Ulcer progresses. It can come upward, like as if it's coming towards the throat. That's when people feel it at the chest. Then the one in the stomach is right there, and then it can also go to the upper section of the small intestine. It can go downwards to the upper section of the small intestine and affect, and then people begin to feel pain at the lower side. So sometimes those pains, that is a sign. As it gets worse and worse, it can also, bloating is there, feeling of nausea, like to vomit and the rest. You're feeling full so quickly, that can be a sign. Then what are the red flags you should take note? When you start having black stool, it's a sign. Ulcer, remember, ulcer is a wound, and wound normally have presence of blood in it. So by the time your stool is now so black, it tells you that internally the ulcer is so bad, and there's a lot of, you are losing a lot of blood, and the blood now is that goes through the digestive process makes your stool black. Already our stool has this characteristic color, or maybe the person is vomiting blood, or the pain is persistent. Now, why am I answering all these questions? It helps us to get better understanding of our body and know what to prevent, what to do, when to really reach out for help. Yes, some people ignore it. They feel it's food. But if it's actually caused by H. pylori, you need to treat that bacteria. Food alone cannot solve it. Can ulcer heal completely? Yes. Ulcers can heal completely if treated. Remember I said if it's caused by the bacteria, once treated, it will be gone. But if it is caused by the drugs, if you stop the drugs, and maybe there are alternatives, or you can manage stress, because most times people fall on those because they fail to manage stress and their body is worked over. They begin to complain of pains, and then they want to hop on these drugs for quick relief. So that's how the cycle goes. So if you can reduce alcohol worsens it. Yes, caffeine too worsens it. Maybe all these energy drugs, like energy drinks like Monster, coffee and the rest, any caffeinated drink, even carbonated drinks like your Fanta and the rest, those drinks that give off gas whenever you open them, they can aggravate it. Spicy food, too much pepper, some people can't eat without a truckload of pepper, can aggravate this. So I'm listing all this. If you avoid this, you are already on your way. Then there are certain fruits you can't take. Fruits like oranges, all these citrus fruits, orange, lime, they're highly acidic, and you're already battling with the stomach acid. You cannot add acid to it, so avoid them. Even this apple that people love so much can also aggravate it. There are other healthy fruits you can take, like watermelon. Watermelon is there, cucumber and the rest. You take those fruits and you'll be good. Avoid, very oily food. Now I'll tell you why. People like palm oil rice, or all this oily food that is high in fat. Let's say ofe akwu, that's this palm oil stew, or palm oil, this banga soup, and the rest. Now that's a very highly fatty meal, and fat takes long to digest. So when fat stays, and as long as there's food in the stomach, it keeps triggering the brain to release more acid, so that because the presence of those acid helps to digest the food in the stomach. So fat now delays in the stomach, so acidic process delays, and more acids are being released that will later cause harm to your stomach, the walls, and even make the ulcer worsened. So please manage, reduce, not too much. Some people like too much oil in their food, and if you are suffering from ulcer, please watch this aspect. Not too much oily, fatty food, avoid them. They're not helpful. All these snacks, buns, fried food, that's avoid them. Yes, some people can begin to say what else will I eat. There are a lot to eat, a lot. I can, if you are interested, I can drop and create another video. Just drop in the comment that you want such. I'll create another video to explain and point out on such combinations. So please, it's advisable we avoid as many as this that can aggravate it. Ulcers can be healed. Ulcers can be healed. Yeah, some people now talk about the milk. I know someone who say take milk. I know someone who also abuses what they call this thing, antacids, like jealousy. Every now and then she's chewing. Every drug, remember, drugs are still poisons. In excess, they can harm your body. I keep complaining that this can lead to kidney issues. So please, don't try to take poison then look for what will neutralize it by taking a drug to no. If you can avoid it from your diet, it goes a long way. Thank you so much for watching this video. Please subscribe to this channel as we share more health tips. Thank you.